Hi, I'm Jennifer Berkowitz reporting for OWTV News. Today's healthcare workers are the key to us beating this coronavirus spread, especially here in Long Island. Today I have an interview with Jacqueline Crawford, a nurse at a hospital in Suffolk, on how she experiences coping with being a nurse on the front lines of this pandemic. Thank you for joining us, Nurse Crawford.
You're welcome.
Can you tell me what hospital you work for and job you are currently doing there?
So I'm actually a nurse practitioner. I work for the Catholic Health System, and I take care of, I'm a cardiac nurse practitioner, so I take care of people with heart issues.
Can you describe what it's been like treating and caring for COVID-19 patients?
It's been somewhat challenging. When the pandemic first started, about a month or so ago, it was extremely stressful taking care of those patients because you have a fear of catching the virus and bringing it home to your family. So I have to say it was quite challenging, but I ended up getting the virus from taking care of those patients. When I got the virus, I was extremely sick, and the virus, some people get very sick, some people don't. Some people don't even realize that they have it. They're just simply carriers. But I got sick when I got the virus, and I was sick for about 2 weeks. I have since returned to work, and I feel like the heightened fear I had before I actually got the virus, taking care of the patients, is not really how I feel anymore. I feel much more at ease. And although we are not exactly sure if having had the virus will completely make you unable to get it again, but for some reason I still feel a lot better taking care of the patients now since I already had the virus. I am not as panicky when I go into the rooms to take care of the patients.
Have you seen a surge of patients coming into the hospital now?
Yes, the hospital is extremely busy. Our ICUs are extremely busy. There's no room. We have had to use other units for ICU, such as the emergency department and some of the outpatient facilities, outpatient recovery rooms to take care of the patients because it's just the hospitals are extremely, extremely full.
What about the ICU and intubations? The governor this morning said the numbers are going down. Has this been your experience?
Well, particularly in our ICU, everybody that's in the ICU is an intubated patient, and that's not normally the case.
Why do you think the numbers have been so alarming on Long Island?
That's a good question. I couldn't begin to really know why they're so alarming in Long Island. I think one of the reasons is that the places where they're alarming, or the particular towns where they're alarming, tend to be places where we have a lot more extended families living together. So I think that that could be one reason. I also think that when we were getting so many numbers in the city, I think that some of the people from the city started coming out to their summer homes in Long Island. And I think that played a part also in the amount of people in Long Island coming positive for the virus.
Do you have enough supplies like PPE, personal protection equipment, etc.?
So it seems to be very labile when it comes to the equipment. I have to say that in our facility, we are guaranteed PPEs every day, a new clean PPE, and we are given that every day. It used to be, though, when you had to wear a PPE, you wore it for one patient and then threw it away. We do have to keep them all day, but that's a lot better than some facilities have. So grateful to get a clean one every day.
What kind of personal effect has this had on you or on your family?
Well, I do have to say that when I first got sick um, with the virus, and I knew I was sick days before I had my test results. Um, I sent my daughter to my sister's house so that she could be safe because quite frankly, she has asthma, and I was afraid for her to get the virus and how her body or lungs would react to the virus. So she's been away now for 4 weeks, and it's killing me that my daughter's gone so long, and I miss her, and I want her to come back home.
I'm sure she misses you too. I hope you can see her soon.
Thank you.
How do you handle the emotional aspect of caring for your critically ill patients?
So I have been a nurse since 1991, and although I've never seen anything quite like this, you do manage when this is your profession to learn to deal with certain things, for example, death and dying, and you do learn to deal with them your own way. This was a little harder than most other epidemics I've seen in the hospital because the prognosis can be very poor. So it is a little disheartening, and it is a little difficult to watch. But myself specifically, I do have a girlfriend who's a therapist, and she's always there willing to have an open ear for me whenever I feel like it.
What has changed in your procedures of helping patients since the pandemic began?
I think it gives you, it makes you remember your compassion. Since this has started, there has been no family visiting. So, in seeing that and knowing these people are so sick, you kind of have a lot of empathy, and spend more time trying to explain, holding their hands, trying to be comforting, because it's not easy for them to be in this situation, and you don't know what's going to happen. You don't know how you're going to do, and it's difficult. So I think I've gotten a lot more compassion.
What are your thoughts on the protesters who want to reopen the economy and who are yelling at healthcare workers, telling them things like to go to China?
Well, I think those people are very silly. It's you know, people don't understand. You really have to be on the front line to understand what kind of effect this virus has had on the people in this country and the people in New York especially. And I know that those people protesting could not possibly be New Yorkers, because New Yorkers have been so badly hit by this virus. And so when you don't see it, you don't really understand. So, I think a little education maybe, I just believe that those people, they don't really understand.
What can the community do to help protect healthcare workers?
Well, for one thing, they can stay at home and only go out for necessities and when it's needed. I think that's a difficult concept for people to completely understand. But as is well known today from Governor Cuomo, as he did his daily report, you can see the drastic difference or how the curve is coming down. And it's because the people have stayed home and stayed inside. And, that proves its point right there. So that's really what the people can do. Stay home. And when they're out, put a mask on their face. I'm so glad that that has become a new law, that they want the people outside to put a mask on their face, because that's going to make a big difference.
How do you feel about being a nurse right now and about the work you and your coworkers do?
Oh, well, it's quite rewarding. Any time that you can help people is rewarding. And anytime your work makes a difference, it's rewarding. So I'm proud to be a nurse practitioner. I'm proud to work for my facility, and I'm proud that I'm doing a difference for the community and for the state.
And what else do you want the public to know about this?
It's a serious virus. It affects the young people, the old people, across nationalities, across ethnicities. It is frankly killing people, and we need to do everything that we can do to keep yourself safe, keep your family safe, and keep the community safe.
Thank you so much again for talking to me today, Nurse Crawford, and for doing the job you do every day.
You're welcome.